internist for my HIV patients because I'm not battling opportunistic infections. I'm battling heart disease, lung disease, liver disease, and kidney disease.
But is it greater if your T cell count is 700 and remains that than it would be for an HIV negative person at our age?
I'm sorry, say that again?
A T cell count of 700 or 800, it's that high and remains that. Are you still at a greater risk for all these other non-opportunistic diseases than
Yes.
HIV?
Yes. Yes. All the stuff I just mentioned. Yes. Yes, sir.
What about optical and hearing? What about optical and hearing?
Oh, eyes and ears.
Yeah.
Ears are, I don't think ears are much of an HIV issue. All of us are going deaf as we get older, but no. There's a lot of syphilis that is in our men who have sex with men. Lots of syphilis. Syphilis will cause deafness. If we see somebody who suddenly becomes deaf, we assume they have syphilis until proven otherwise. But besides that, no. Eye disease, there's not really any HIV-associated eye disease if you take care of yourself. Obviously, if you get CMV retinitis, it's a disaster. Yes?
I'm diabetic. People who have diabetes and other diseases that come on with age. I'm type 2 diabetic. HIV has not helped me in it. Because it breaks down my immune system. Immune system goes haywire. I get more things than anybody else. And blindness runs in people with diabetes. It runs their way and what's the film in your eyes, what's called cataracts. I have a little bit of that in my, they see it. But you gotta if I keep myself under control and keep myself right, I will not, I have less a chance of getting these opportunistic diseases.
Nobody who's in care is at risk for opportunistic infection, except for lymphoma. Your job, no carbohydrates, be as thin as you can, take your meds.
That's the problem. You're homeless, you have no,
Homeless
you have no partner. That's the problem you have. They throw carbohydrates at you. I mean, every time.
Our next presenter is Wayne Marquardt. Where is Wayne? Wayne Marquardt is a pharmacist at the University of Pennsylvania. I'm going to give it over to Wayne.
Okay, good morning, everyone, and thank you for coming today. If we can get the slides on. My responsibilities here today are to be talking about medications. When the committee first got together and we were talking about this, actually Penn awarded the Elder Initiative a grant to talk about medication safety, how to promote medication safety and medication awareness. And this is going to be one of the first parts of the program. So what I'm going to be doing today is going over some very general ideas on how to be a safe and effective communicator and also a person who is taking medications. As Heshi was saying a little bit later on, at the end of this program, myself and there'll be another pharmacist here, hopefully we'll be sitting down and talking to anyone who wants to talk about specific drug therapies, specific drug regimens. Because as Dr. Stern can show you right now, there's a number of different things that are going on. We could take hours just talking about them. But basically, I'm going to be talking about how to be an effective consumer on medications and what you need to do when you are prescribed medications. What are some of the things that you need to worry about and be concerned about with them? So if I can get to the next slide, please. Okay, basically, from a pharmacy standpoint, and this doesn't matter if I'm a hospital pharmacist. I've been working in the University of Pennsylvania for about 32 years right now. But it doesn't matter where you're going, if you're going to a CVS, a Rite Aid, a Good Neighbor Pharmacy or whatever, it is really imperative and important, especially for people who are on multiple medications, especially from different doctors, of using the same pharmacy to get all of your medications filled. The concern that we have as pharmacists and also as physicians is that a lot of these medications, especially if they're coming from different sources or different places, can have drug interactions. As Dr. Strand was saying before, there are a number of different things that we need to worry about concerning your liver, your kidneys, things along that line. A pharmacist can actually help pick up on a lot of those things, but if you're going through a number of different pharmacies, one thing which most people don't realize is that everything is on computers right now, but CVS's computer does not share information with Rite Aid's computer, which does not set up any information with the hospital pharmacy that you may be going to as well. So make sure that your pharmacist and your pharmacy and your physician carries a full list of medications that you're on. So this is not just your prescription medications, this is over-the-counter medications, and especially we're looking here that we have a number of ethnic minorities around, and both in Asian, both in the Black and the Hispanic communities. A lot of times we're seeing herbal remedies being used as well, making sure that everyone knows exactly what you're on. So basically use your pharmacy for all those things. The other thing which I can't recommend enough, and I will have a number of those out there today, is knowing what you're on and having a list of medications that is with you at all times. If you're going into the hospital, if you're going to see a new physician, if you're going to a new pharmacy, letting them share that information so that, again, you can probably take as safe a medication regimen as possible. Next slide, please. Okay, now, big thing here, indications is a big pharmacy and medical word, meaning why are you using this drug? And a lot of drugs that are out on the market right now have a number of multiple uses for them. So the same drug that is being used for hypertension can be used for also lowering some other things. Some of our HIV medications are now being used in other instances as well. If you're taking beta blockers for, let's say, hypertension, they can also be used for speech impediments. They can also be used for depression. There's a number of other these drugs that they can be used for. So making sure that you know if your doctor has put you on a medication, why you are using it. Basically, one of the things which most people don't realize is that when a physician writes a prescription, what the pharmacist will usually do, or what the pharmacy will usually do, is on your prescription label will say, take 1 capsule twice a day, take 3 tablespoons twice a day, or whatever the information is. You can actually request to have the pharmacist put what you're using that for right on the label. So this way, if it's there for you, but it's also if a family member or relative or a caretaker is there, they're knowing what it's being used for as well. Or if you have to go into the emergency room or another place, it's all there for you. And basically keep that personal list with you and share it with a family member or family friend as well, in case there's a point that you do become incapacitated. And especially with our HIV regimens, because as Dr. Stern was saying before, is not only are we taking your HIV meds right now, you may be taking meds for cholesterol, you may be taking meds for hypertension, you may be taking meds for depression and a number of other different things. So there can be a plethora or just a huge amount of opportunities for drug interactions here. Next slide, please. Okay. Basically, one of the big things that we all take a look at is saying, know how to take your medications and how to take them properly. Know, and especially with our HIV medications that are out there right now, and also with some of our antibiotics and things, know how to take them because there may be specific dietary arrangements. You may need to take this on an empty stomach. You may not take calcium with it. There are a number of drugs which are out there, especially in our antihypertensive group and our cholesterol group. You can't take grapefruit juice. So it's not just drug-drug interactions anymore. We're now also looking at drug-disease interactions, and we're now talking about drug-nutrient interactions. So make sure that if you are taking this, that you know if there are any specific indications on when you can take this. Some of your HIV meds you have to take with a fatty meal, or making sure that you're having something along in your stomach with it. Knowing if these drugs can be taken on a full stomach or an empty stomach. So it's going to depend on how much the drug is absorbed into your body, depending on how much either acid or lack of it is in there. Next slide, please. Anyone here diabetic using insulin? Okay, anyone here asthmatic using inhalers? So we've got a number of people